Not knowing that my water is not safe puts a stress on us, and we can't really take care of ourselves in the long run, not knowing what we're putting in our bodies.
The lead and copper rule was established in 1991 by the EPA under the authority of the Safe Drinking Water Act and its amendment in 1986. Under that amendment, it banned the use of lead-containing plumbing materials. But under this regulation, it did not require the removal of existing lead lines. So that means all of the lead lines have been remaining. The EPA estimates that about 9.2 million lead pipes remain in service throughout the country.
The studies keep coming out that the pipes are old. There's lead everywhere.
In the summer of 2024, the Water Collaborative set out to collect water samples across New Orleans to better understand lead and copper levels in residential drinking water. In New Orleans, drinking water is managed by the Sewerage and Water Board, which was established back in 1899. Our water is sourced from the Mississippi River and treated to meet safety standards before reaching homes across the city. Because New Orleans is a city that is over 300 years old, monitoring where lead lines are has been an ongoing challenge. Many of our underground water lines are aging, and identifying which ones are lead requires substantial resources and coordination. However, many federal changes are underway. The Biden administration's Infrastructure Investment and Jobs Act of 2021, along with updates to the federal lead and copper rule, aim to address these challenges by providing funding and clearer regulations to accelerate the replacements of lead service lines nationwide. At the Water Collaborative, we collected a total of 286 water samples from 144 residences across Orleans Parish, testing for both lead and copper concentration. 83% of the samples showed detectable levels of lead. Out of these, 15 samples from 11 households exceeded the federal action level of 15 parts per billion. There were no exceedances of the federal action level for copper.
So was there lead found in my water? Yes, there was lead found in my water, which according to the Environmental Protection Agency, that is in fact a healthy level.
There was not lead found in the home I currently live in. However, I grew up in those homes, and I drank that water, and I know lead doesn't go anywhere. If it's malleable, it flicks off, it's in your body. It's in your body.
So I got an email with my results, and I was nervous about reading it because I figured there's a good chance that there was lead in the water living in New Orleans. And the results showed, in fact, it was above the federal limits. One was 17, so I'm like, oh, not so bad. And the other was 25. Am I an outlier? Am I really high? Is that sort of the norm? Federal limits are based on what? You know, does it affect your immunity? Do I tell guests, I can't serve tap water again, right?
The action level exceedance for lead in water is 15 micrograms per liter, or ppb. This is not a health-based standard. This is a trigger value, which triggers the utility to investigate what the situation is. And nationally, it helps the EPA to prioritize the cities that might need more support.
The nation's lead and copper rule basically had no deadline or requirement that all lead pipes in this country be removed. And it also had a very high trigger level for water utilities to take action to improve the likelihood that lead would not be released from people's water.
The lead and copper rule revisions, which were the first comprehensive updates to the rule, were set in 2021, and they are set to partially go into effect this Wednesday, October 16th. It has two major effects. One is that it is lowering the action level from 15 to 10 parts per billion, and now it is mandating the removal of all lead service lines within 10 years.
Anybody who needs water should have water. It is a human right, and it shouldn't be denied to them because they can't afford it.
Started buying Ozarka bottles of water, and then moved on to Kentwood, having a Kentwood machine, so they're getting bottled water delivered, so I don't drink the tap water. And in terms of the cost, it's about $100, $120, and that gives you about 4 or 5 5-gallon bottles every 2 weeks, and we use every last drop.
I mean, reading it and then just walking around, and then how many times do you turn the faucet on to brush your teeth, to drink water in the middle of the night, to make coffee, to boil pasta? And I did the research that boiling it isn't enough for lead. So it's really don't use any of the water, and that's almost impossible.
Water regulation is not perfect. It's not all encompassing. We have to be more vigilant about protecting our own households, our own families, and there are ways to do that. These lead certified water treatment systems that work at the pipe or as a pitcher that you can put in your refrigerator, and it will reduce your lead intake considerably.
But the work doesn't stop with installing filters. The only permanent fix is to remove and replace the sources of contamination entirely.
My youngest sister, when she was young, in our house living on South Salcedo, it was in a paint. And being a child, she ate lead. From that point on, she actually did not excel academically as her other siblings did. She suffered a lot from asthma, skin conditions, and sorts like that.
I think about first my own child and the fact that if I allow her to drink the tap water, that it could lead to different neurological or other health issues. Maybe that's why she's so tired all the time, because she takes a shower in that water. All of those things kind of cross my mind in trying to make sure that am I making good decisions for her.
We need to educate our healthcare providers about this issue to keep it at the forefront of our conversations, because it's still an issue. It will always be an issue because it's a metal. And what do we know about metals? They stay in the environment forever. Even the lowest amounts of lead that we intake, has an effect. It has an effect on our cognitive abilities. It has an effect on our children's neurodevelopment. It has an effect on their behaviors. It affects how well they do in school, their social behavior. Now, when we start aging or we get stressed out or we get pregnant, that lead will leach back out and it goes right back into our bloodstream. So we have this inner source now of lead and we keep re-exposing ourselves to it. You may be a child exposed to lead, but you're going to carry that lead with you throughout your life into your reproductive age.
As we all know, there is no safe level of lead. Lead is a serious public health risk that can cause irreversible effects, especially to children.
After Katrina, I had opportunity to do plumbing work. We renovated a lot of homes in New Orleans. I came across a lot of lead. We had to replace a lot of main line from the water meter to the home. And so when we have to connect to the service line, that was a lead line we connected to.
Utility companies often dismissed lead in water as a non-issue. Even pediatricians that I talked to really didn't think lead was a problem anymore. Unfortunately, in New Orleans, we have a very high risk for lead exposure. It's in our soil, it's in our paint, because we are an old city, have old homes, and we also have a lot of lead service lines.
Over the course of 16 weeks, our team of 7 fellows collected water samples from residents' homes through scheduled appointments. We gathered both the 1st and 5th liters of water after requesting that residents avoid using any water in their homes for at least 6 hours to accurately assess potential contamination.
Working with the Water Collaborative has been extremely positive.
They communicated with me when to use the water, to let it stand for about 10 hours. They came, they got the water, they left, and then I got the results in a timely fashion.
I was able to get a free water filter afterwards, which I use to the day, and my dog could have filtered water now. Yeah, so I think that was a great plus being part of the program, and I feel even better.
In Sewage and Water Board's 2023 Consumer Confidence Report, results from their 2022 survey showed that 94 households were tested for lead and copper. While copper levels were within regulatory limits, 2 samples exceeded the federal action level for lead. In contrast, our study revealed a significantly higher number of exceedances, suggesting a more widespread issue of lead contamination in the community. This comparison underscores the importance of comprehensive data collection to accurately assess water quality and identify potential problem areas that may otherwise go undetected.
The New Orleans Sewage and Water Board released their service line inventory, indicating the material of the service lines throughout the city. Of the map that they gave, about 15,000 customers were identified to have lead pipes serving them, either publicly or privately, as well as 119,000 customer lines were identified as unknown. This shows that it is a starting point for helping to prioritize replacements, and the overwhelmingly large number of unknowns highlights the need for continued testing increase public education, as well as the distribution of lead filters to help mitigate exposure for all residents, as until all service lines are identified and replaced, many are not sure if they're being exposed on a daily basis.
Data collection is important because when you have the information, then you can utilize that to make decisions, whether they are determining where you're going to allocate resources. But if you don't have the data, you can't get the grant money, you can't get the resources effectively allocated, and you don't have the quantitative information to be able to back up the decision-making processes.
It's important that as we collect data, that it's not extractive, that those people who are collecting the data are included all the way through the process.
I would say any single person living in the city should make an effort to have their water tested for lead.
I'm really excited to see the city of New Orleans in particular has been really supportive and really helpful. I really want to see more citywide testing. I think every home, or a majority of homes, should have the access to get their home tested. So they know what their health risks are in the moment. They should know what to do to mitigate lead.
I think the thing that makes me most optimistic is that the public is beginning to become aware of the importance of investing in our water infrastructure, including getting the lead pipes out.
We embarked on this process because we saw a lack of engagement and transparency. We wanted to see what a more community-focused approach would look like, and the results speak for themselves. It's very different. Since no amount of lead is considered safe for consumption, all levels of exposure should be addressed to protect community health. Now that we have this crucial data, it's time to take meaningful action. Our mission continues as we advocate for increased funding, full lead service line replacements, and widespread public education. Together, we can create lasting change and protect the health and well-being of our community. To stay connected, you can find us at nolawater.org.